Fertile window is a period of the menstrual cycle when the chances to conceive or become pregnant is very high. Understanding ovulation and the fertile window is fundamental to timing or planning intercourse to conceive or to avoid pregnancy. To accurately predict your fertile window, you need to know your menstrual cycle length and your ovulation date. Menstrual cycle length is the first day of one period or menstrual bleed to a day before the next period. A normal menstrual cycle length ranges from 21 to 35 days. Ovulation is a day in the menstrual cycle when a mature egg, ovum, is released from a mature follicle from one of the ovaries into the fallopian tube. According to clinical guidelines, ovulation occurs about 14 days before the start of a new menstrual cycle. This means that your ovulation date is your menstrual cycle length minus 14 days. For example, if you have 31 days cycle, then 31 minus 14 is 17, so your ovulation date is day 17 from the day you see your menstrual bleed. You can watch our previous videos on how to calculate your menstrual cycle length and ovulation date for both regular and irregular menstrual cycles. Research shows that the timing of fertile window varies from person to person, even if their menstrual cycles are regular. It is important to note that many factors can influence ovulation, causing it to occur earlier than expected or delay. Stress or illness can occasionally disrupt the menstrual cycle, causing earlier or delayed ovulation. Some medical conditions such as polycystic ovary syndrome, endometriosis, thyroid disorders, or hormonal imbalances can impact ovulation, causing delays. Significant weight loss or gain can affect hormone production and consequently delay ovulation. Certain medications, such as antidepressants or hormonal treatments, can affect ovulation timing. Sudden changes in time zones, sleep patterns, and environmental factors can also disrupt the body's hormonal rhythm and potentially delay ovulation. Exclusive breastfeeding can sometimes suppress ovulation, causing a delay in the return of regular menstrual cycles. As women age, there can be variations in ovulation patterns, with potential delays or irregularities in the menstrual cycle. Intense or excessive physical activity can affect hormone levels, causing ovulation to be delayed in some cases. Also, exposure to certain chemicals or environmental toxins can interfere with hormonal balance, affecting ovulation. Accurate timing of ovulation and fertility window is a key factor to maximizing the chances of conception. Statistical observation of women and their menstrual cycles proved variation in ovulation timing. Hence, the accuracy of the clinical guideline of ovulation date being 14 days to the next period is questionable. Due to menstrual cycle length variabilities in women and many factors influencing ovulation, ovulation can happen a couple of days earlier or later than the estimated date. For this reason, there is a rule of thumb to simplify this variabilities and to help women calculate their fertile window with some level of accuracy. This is the 14 plus or minus 2 rule or formula. Remember, this is not a scientific rule. The plus or minus 2 formula simply means ovulation can occur 2 days before or 2 days after the estimated ovulation date. According to the clinical guideline, women with 28 days menstrual cycle length will ovulate on day 14. But studies show that due to varied influencing factors, not every woman with the 28 days cycle ovulates on day 14. Only a small percentage of women with the 28 days cycle ovulate exactly on day 14. Some women ovulate few days before or after day 14. This brings about the 14 plus or minus 2 formula in estimating possible ovulation dates. We will apply the plus or minus 2 formula to determine the ovulation period using 28 days cycle as example. According to the clinical guideline, in 28 days cycle, day 14 is the ovulation date. Plus or minus 2 of 14 is 14 minus 2, which is 12, and 14 plus 2, which is 16. Therefore, the ovulation period is day 12 to 16. This simply means that if you have 28 days cycle, be it early or late ovulation, you are likely to ovulate on any of these days: 12, or 13, or 14, or 15, or 16. Remember, ovulation can only occur on one day. Another example, ovulation date for 30 days cycle is day 16th. Using the plus or minus 2 formula, 16 minus 2 equals 14 and 16 plus 2 equals 18, so ovulation can occur on any day from 14 to 18. This formula applies to all cycle lengths ranging from 21 to 35 days. Note that, after ovulation, the egg typically remains viable for fertilization for about 12 to 24 hours or 1 day. And sperm can survive in the female reproductive system for up to 5 days. This means that if sperm is present in the reproductive tract before ovulation occurs, the egg can be fertilized. In other words, having intercourse 5 days leading to ovulation can result in possible pregnancy. So, a woman's fertile window spans from 5 days leading to ovulation and 24 hours after ovulation. Remember, the egg is only viable for 1 day. This means, for 28 days cycle length with ovulation period from day 12 to 16, 14 plus or minus 2, it means if there is an unprotected sexual encounter on day 8, the possibility of getting pregnant is high should you have early ovulation. So, the fertility window for 28 days cycle starts from day 8 to day 16. For a 30-day cycle, the fertile window starts from day 10 to 18. If you are trying to conceive, these are the best days to plan sexual encounters to increase your chances of conception. On the contrary, if you don't want to get pregnant, these are your unsafe days. You must avoid intercourse or use barrier methods or protection during this time to avoid unplanned or unwanted pregnancy. In summary, not every woman will ovulate 14 days to their next menstrual period. Use the 14 plus or minus 2 days formula to estimate the days you are likely to ovulate. The fertility window is 5 days leading to your estimated ovulation period. Knowing your ovulation period and your fertile window empowers you to take charge of your reproductive health and informed decision-making regarding family planning. Thanks for watching.